Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Rickets. In rickets, there is defect in mineralization of osteoid matrix in rickets. Causes of rickets. Vitamin D disorders can cause rickets. Vitamin D disorders like nutritional deficiency, malabsorption, or increased degradation of anti-epileptic drugs. Malabsorption of vitamin D, or there can be increased degradation of vitamin D, especially in the presence of anti-epileptic drugs. Vitamin D rickets type dependent rickets type 1 or vitamin D dependent rickets type 2, or in chronic renal failure you can see that there can be rickets. Rickets can also occur in calcium and phosphorus deficiency. Then renal phosphate losses can also predispose to rickets. That is, this is an X-linked hypophosphatemic rickets. In renal phosphate losses, we see X-linked hypophosphatemic rickets. These are the most common hypophosphatemic rickets. Renal phosphate losses are X-linked hypophosphatemic rickets is an autosomal dominant and recessive hypophosphatemic rickets. Here, there are hereditary hypophosphatemic risks are seen, and there is increased phosphate ion production is seen, and there is McCune Albright syndrome also. And here, renal tubular acidosis is also seen. Normally, cholecalciferol in the presence of liver, it forms 25 hydroxy vitamin D3 or 25 hydroxy cholecalciferol. This 25 hydroxy cholecalciferol in the presence of kidney, it forms 125 dihydroxy vitamin D3 or calcitriol. This will act on the vitamin D receptor. Clinic
thank you and thank you for watching.